Good afternoon, everyone, and thanks very much for the opportunity to present this research I conducted with the National Cancer Control Programme. So way back in 1988, the WHO classified alcohol as a Group 1 carcinogen, so putting it right up there in the highest risk group alongside asbestos, radiation and tobacco. However, it wasn't until 2023 that the WHO came out and said, look, in fact, there's no safe level of alcohol consumption and your risk of cancer increases with even low levels of alcohol consumption. We know that alcohol is causally linked to cancer in 7 separate sites, and it was estimated there were approximately 1,000 cases of alcohol-attributable cancer in Ireland in 2020, giving a population attributable fraction of 3.9%. However, cancer prevention can be achieved by reducing exposure to modifiable risk factors, such as reducing or eliminating your alcohol consumption. Sounds straightforward, but as we've heard here this morning, alcohol consumption is high in Ireland. We've Healthy Ireland data from 2023 here, showing that 70% of respondents in that nationally representative survey consumed alcohol in the last month. And when we look at the international literature, we see that awareness of this alcohol cancer link is in fact quite low. And this is important because it's the first step on a complex pathway towards behaviour change. So bearing all of this in mind, and to inform national cancer prevention strategies, we opted to look at awareness of alcohol as a modifiable risk factor for cancer in Ireland using the inaugural National Cancer Survey database. This inaugural National Cancer Survey was conducted by the NCCP in 2022. So very briefly, I conducted a literature review and I conducted secondary data analysis of the National Cancer Survey database to establish prevalence of unprompted awareness of alcohol as a risk factor for cancer in Ireland, to explore any possible associations of this unprompted awareness with socio-demographic, medical and or lifestyle factors, and then to develop recommendations for evidence-based interventions based on what we found. Very briefly, the data collection and sampling. So the data collection was conducted by Ipsos using a nationally representative sample of 2,874 adults in Ireland. So this was in the Republic of Ireland in the first half of 2022, conducted by phone using random digit dial. The questionnaire was based on population-based cancer surveys that have been conducted in other jurisdictions, and it focused on 2 types of awareness. So unprompted awareness, which is elicited using open-ended questions, and prompted awareness, which is elicited using close-ended questions where the respondents are given a list of answers. For this particular study, we elected to look at unprompted awareness as the key response of interest, as it's least biased and closest to action. So what did we find? So of this nationally representative sample of 2,874 respondents, we found that 43.7% had unprompted awareness of alcohol as a risk factor for cancer, which doesn't seem too bad until we see that of the same group, 81.6% had unprompted awareness of smoking as a risk factor for cancer. So we can see here some work to be done. Then I conducted a multivariable logistic regression model looking at any potential associations with awareness and found that those of female gender, middle and older aged, and with higher levels of medical literacy were all more likely to be aware of the alcohol cancer link. In addition, those with cancer experience, those with higher levels of physical activity, and interestingly, those who drink more were more likely to be aware of the alcohol cancer link. Education, employment, ethnicity, and smoking were not found to have an association with awareness. And finally, on the results, so very interestingly, when we looked at agreement with statements regarding alcohol, particularly in those who were aware of the alcohol cancer link, we found that over 46% of those respondents aware of the alcohol cancer link agreed with the statement that drinking alcohol only causes cancer if you drink a large amount over a long period of time. So we can see here certainly some confusion and misconceptions held even within those who are aware. So a clear gap in awareness of the alcohol cancer link at population level in Ireland, some subgroups with even lower levels of awareness, males, younger age, those with lower levels of medical literacy. And while there are some groups who are more likely to be aware of the alcohol cancer link, as we saw in the previous slides, there are certainly misconceptions held. So in terms of recommendations, based on the findings of the study and including the literature review, the first is to consider raising awareness of the alcohol cancer link. It would be very important that any such interventions would leverage existing programs and partnerships for synergy, that there would be clear, consistent messaging that it's any alcohol increases your cancer risk, and also that it would include both primary and secondary cancer prevention. So we're looking at cancer prevention in cancer survivors as well. So it's still early days, but in terms of translating research into action, so at the moment we're looking at targeted messaging for subgroups. So we're talking with our fantastic regional cancer prevention officers who are pictured here and the brilliant local alcohol leads looking at trying to work in this space. And at a population level, so we're looking at linking in with the Making Every Contact Count programme to incorporate the findings of this study. And we're also working with Alcohol Action Ireland. I see Sheila here in the audience looking at media campaigns to disseminate the findings of this study. Secondly, the second recommendation, again, very important considering the context of this conference, is that we use research to support policy. So we use these really valuable baseline data to support policy. To do this, we're sharing these data with the Department of Health to ensure that there's ongoing support, highlighting the lack of awareness of the alcohol cancer link to support the ongoing implementation of the Public Health Alcohol Act 2018. In particular, Section 12, so as we've heard here this morning, this WHO-endorsed measure for raising awareness. And what's great about this is that when you look at the literature, raising awareness actually increases support for alcohol reduction harm policies as well. So really, it's a double benefit. The further recommendations then are to continue surveillance and research. So for example, high quality research with groups such as cancer survivors to ensure that there's appropriate and sensitive messaging. And finally, close and sustained ongoing stakeholder engagement with key groups such as the audience here today to ensure the most meaningful translation of these research findings into action. So finally, in conclusion, there's a clear gap in awareness of the alcohol cancer link at population level in Ireland, particularly evident within certain subgroups. Misconceptions exist, even within those who are aware. It's clear action is needed. So with that, I'd like to thank you all for your time and welcome any questions or feedback on next steps from the floor.